Historically, MAT and abstinence-based SUD treatment has been two competing philosophies, often at odds with each other. This is wrong. Over the past 10, 15 years, the data has become more compelling. New medications have emerged. Providers have begun integrating primary and behavioral health, as have we. And providers have embraced data rather than anecdote to use MAT in conjunction with the strong evidence-based behavioral health treatment. So the result is the behavioral health providers using MAT are getting better outcomes, including higher treatment completion rates, increased lengths of stay, decreased relapse, and decreased new arrests and bookings. So Odyssey House's data is quite compelling. We use multiple medications to aid in opioid use disorder. Methadone is by far the most used replacement therapy. We partner with Project Reality. Our patients are duly enrolled at Odyssey House and Project. Odyssey patients go to Project at a designated time in the morning together and get dosed. They're seen by providers at Project. Medical providers and or clinical staff at Odyssey coordinate with Project staff to address any issues that may arise, including adverse reactions, or in the rare case that somebody is nodding off in group, we can alert the providers at Project that this is maybe a too high of a dose. We also see people with Suboxone. It's more rare in our patients because oftentimes too expensive and isn't covered except on commercial plans. And then Vivitrol, which is probably the most used medication in our environment. Most people who have come to Odyssey House have had a period of abstinence and don't have a gap in between a detox instance or an incarcerated episode. So they're coming from jail to Odyssey, or they're coming from detox to Odyssey, and there's not that break. So our data over the past year and a half of opioid use shows pretty significant data trends. So just as a matter of coloring in a little bit, an abundance of data, as I'm sure you guys know, across the field shows that the longer a patient's length of stay in behavioral treatment, the better the long-term outcome. Therefore, the stats really are quite compelling. So on average, our length of stay without medication use is 77 days. And with methadone or Suboxone, it's 103 days. With Vivitrol, it's 132. So we're almost doubling our length of stay, and we're having tremendous outcomes with any use of medication. 50% of patients without medications complete treatment. 58% complete treatment with methadone or Suboxone, and 73% complete treatment with the use of Vivitrol.